You're listening to Boomers Today with your host, Frank Sampson.
Well, welcome to Boomers Today. I'm your host, Frank Sampson. Of course, each week we bring you really important and useful information on issues facing baby boomers, their parents, and other loved ones. And as I do on every show, I thank all of you. And I thank all of you because our listeners keep growing each and every day. And it's because of you. You know, we don't do any advertising for this show or podcast, but you send out individual podcasts or entire show to friends and family to listen, and we really so much appreciate that. Our records show that many of you listen on Apple Podcasts and Google Podcasts, Spreaker, Stitcher, iHeartRadio, you know, pretty much all the podcast stations out there, and we really appreciate it. And you know, it's quite clear why our listeners are growing and why you're sending our podcasts or individual podcasts to friends and family, because we have just wonderful guests. We're not going to disappoint you today. We have with us James Sabursky, who's a retired assistant professor, coordinator of gerontological education, and the director of geriatric care management at Misericordia University in Pennsylvania. How'd I do, Jim? Did I do that?
Very
right?
good.
Okay, good. He's an affiliate member of the American Association for Geriatric Psychiatry, is certified in gerontology by the National Academy of Certified Care Managers. He's an editorial advisor, board member of Today's Geriatric Medicine, a prior member of the National Association of Professional Geriatric Care Managers, and a prior member of the board of directors of the Greater Pennsylvania Alzheimer's Association. He has multiple publications, lectures, and consults in geriatric, psychiatric, and intellectual disability populations. So if I may call you Jim, welcome to Boomers Today. I really appreciate you taking the time.
Pleasure is mine.
Yeah. So, boy, lots to talk about. We got to try to get it done in the amount of time we have allocated here. But I guess, you know, what goes through, and I'm right, you know, smack in the middle of that boomer generation. So, you know, knowing in this industry of senior care and, you know, aging, I get questions all the time from friends and family. And so one of them that I get, and I'm going to ask you, you know, are memory issues preventable?
In a sense, I would say yes. Alzheimer's, for instance, if you pay attention to your diet, you don't have to be extreme. Everything in moderation, including moderation. Exercise, you'll learn something new every day. There are supplements out there. I don't strongly recommend them, but there are out there. Maybe we can talk about them a little bit. But if you take care of your memory, good sleep, very important, because it's at night where we consolidate our memory. Exercise, more blood gets to the brain. That helps the brain. And you can do three things. You can maintain your cognitive ability by brain exercises. These exercises should involve novelty. Try new things. Now, you don't have to spend a fortune here. If you eat with your left hand, eat with your right hand. Learn to dance. Learn a new language. Question I get all the time is maintaining your cognitive health. Can I do crosswords? Yes, you can. But if you can take a crossword and finish it in 5 minutes, there's no challenge there. It has to be a challenge, just like lifting weights. If you only lifted 5 pounds all your life, you're really not making any gains. So you need to challenge yourself, and variety is very important to maintaining brain health.
I mean, yeah, you know, there's so many, you bring up, you know, great points, you know, even brushing your teeth, or, you know, you use the other hand, you know, those are great points. So what about, you know, when somebody notices, or a family member notices that their loved one, or they even know. I mean, listen, I notice myself, sometimes, being a little more forgetful as we
Well,
age. But
me
and
too. I
people.
forgot my brother's birthday, and we're twins.
So what would you say? Kind of what's first action to take when you start realizing that?
Well,
Where do you go? What
once
do you
you
do?
realize there's a problem, you need to have a diagnostic workup. As a care manager, I had a lot of patients I would go out and see who had exactly what you're talking about. And I would spend about an hour and a half with them. I had the advantage of a memory clinic up here, and I would take them to the memory clinic. A primary care professional can make the diagnosis, but it's time consuming. It takes, in a memory clinic that I interacted with, it would be 3 hours, 2 or 3 visits. But you do a comprehensive cognitive and functional history. I want to know if they had ADHD, things like that. Again, boomers, if they're women and they're past menopause, a lot of women notice that their memories aren't as sharp. Physical exam, neurological exam, blood work. I'm particularly interested in thyroid, B12, and D3. I'll always ask the doctor, and they're generally very good about that. And then I will do a mental status exam, check for depression. Big deal here. People that are depressed tend not to have good memories. If you can treat the depression, even if they do have a neurocognitive disorder, treat the depression and you'll take some of the weight off of them and they may function much better. And a cognitive screen I use is the Montreal assessment, MOCA, and I do that because it has a good sensitivity and specificity. Sensitivity is when it says you have something, a cognitive disorder, and you do, and specificity is when it says you don't and you don't. Most of these, most of the MOCA is a 9 out of 10 on both of these areas. The thing they can do, though, is pick up something very early, a mild problem, or a lot of these screens cannot. So I'm going to get all that worked up. There's blood tests. You can get imaging depending on what the physician or the treatment person sees. They can get different types of imaging, but you will come out with a diagnosis, and you may find out that it's due to vascular, due to cognitive disorders, Alzheimer's disease, Lewy bodies dementia, Parkinson's dementia. These can we have to tease all these out
So
and then come up with a good treatment plan.
yeah, so a couple follow-ups there. I mean, let's look at today's world um, that we live. I mean, and I'm only going by my personal experience,
Mm-hmm.
people my age group personal experience, but I think it's happening everywhere. There just seems to be, to me at least, a shortage of professionals in this field to be able to help. All right, whether they
Without a
be
doubt.
with physicians, they're overworked. It's tough to even get appointments. You're doing phone calls with them more often than ever because they don't
Yep.
have time to even see you. So, I mean, what you said earlier makes total sense. But where should somebody start? Should they be going to their primary? Could they go to another type of a specialist? What are your thoughts there? And
Well,
yeah, go
could
ahead.
they definitely could go to their primary, but in terms of say Alzheimer's disease, the primary gets it about 6 out of 10 times right. I take my patients to memory clinic, teaching hospitals. We have a big hospital system up here that has a very good geriatric component to it. Um, so I would preferably, if they have the insurance or the means to cover it, I would go to a memory clinic. I would just call the AMA and ask them where the closest one might be, phone book, Google, what have you. That's probably where you're going to get your most accurate diagnosis and your best interventions.
Gotcha. So you were mentioning earlier about, various types of dementia. You were mentioning Lewy body
Hmm.
and, all that. So let's take a step back,
Okay.
and let's give the, just basic education. When someone hears the term dementia, they hear the term Alzheimer's. Explain, the difference and so people kind of understand that as well.
A lot of my patients had come up to me and said, I have Alzheimer's disease and dementia.
All
Well, the
right.
fact is, because they have Alzheimer's, they have dementia. So, whatever neurocognitive disorder we're talking about, vascular neurocognitive disorder, strokes can be at the root of that. Frontal temporal neurocognitive disorder, you're going to notice inappropriate behavior, things that they would never do or never say, or you'll see a change in their sleep patterns. Head trauma to an older boomer like me is not a very good thing to look forward to. If they're falling and having hallucinations, it may be Lewy body's dementia. So we need to find out what's causing the neurocognitive, and the word everybody uses today is dementia, because the treatments are going to be different for each one.
And those that feel they have it, what would you say to people who feel they have it and they don't want to go in for professional help, and they say, if I got it, I got it. There's no cure. That's the way it goes. What do you say
Well,
to those people?
well, I tell them as clearly as I can what the future may hold for them. I suggest to them that they do have, in my opinion, a neurocognitive disorder, and they may want to see an elder care attorney to get their wills and stuff in order, and that if they want to keep the memory as long as they can, I will suggest that they exercise, they watch their diets, and I would also suggest that they do a brown bag test on themselves or the family member, and that's where you put all your medication prescribed as well as over the counter and what you might be borrowing from your neighbor into a bag, and you have a pharmacist or a professional review the medication. Over-the-counter medication, for instance, a lot of boomers I know, they'll take these sleep aids to get to sleep. Well, frankly, they're like, many of them are like Benadryl, and Benadryl is what we call anticholinergic, and if it dries the mouth, it'll dry the brain, is my motto. Anticholinergic drugs decrease concentration, add to confusion, forgetfulness, falls, and be clear that boomers are, in cases, going to have to take medication that's anticholinergic. The goal is at the lowest dose that it'll be effective for the shortest period of time, which may be the rest of their lives. But I try to minimize my patients. If they won't do anything else, I'll ask if I can review their medicine, and I'll have someone do it for me, and make suggestions that they can take to their doctor or the family member can, because that will. I had a lady once who was 80-some years old with 2 PhDs. I was working with her for post-traumatic stress disorder, and she was a challenge, very highly educated. I went away on vacation, didn't see her for 3 weeks, came back, and they said she's on the other floor for dementia. She has Alzheimer's disease, and I thought that's impossible. And what it was that her brother said that Valium would be good for her
Oh,
muscles.
oh
And
no.
indeed it would, but it also messes with the older person's brain terrible. She looked just like she had Alzheimer's. Stopped the medication, 3-4 months later she was functioning again.
Hey, I know somebody that got placed in a in a memory care,
Mm-hmm.
and she had an IUD.
Ooh.
he got placed in memory care.
Huh. Yeah,
Right.
go figure.
Go figure, right? So yeah, you got to be careful with that. Let's stay on this brown bag
Yeah.
assessment. All right. So a couple questions for you. You brought up a really good point because, well, number one, you start out by saying sleep is very important. All right. But then there's those people who have challenges with sleep. All right. So what suggestions do you have in that case? And a lot of people do go to those over the counter like Benadryl, and what you said is so very true. You want to stay away from that. That could have a negative impact. But what do this is probably a much bigger question. We could probably do a show just on this subject matter. But generally speaking, what recommendations do you have to people who are having challenges sleeping and are pretty frustrated from it?
I'd have them or their person that's their caregiver Google sleep hygiene. There's an awful lot of things in terms of sleep that can interfere. Caffeine, chocolate, alcohol. My wife and I, we'll be married 50 years next year. We'd like to have a wine at 5 o'clock, but it interferes with our sleep, so we have it at noon. And it doesn't interfere with the sleep then.
Right.
But sleep hygiene is really important. Actually, even when somebody with a neurocognitive disorder goes to a nursing facility, I recommend they bring their bedding with them, the pillow, the covers. That will help them. Sleep. You can also, again, with doctor's permission, and I'll talk a little bit more before we're done on this, you can provide melatonin. Melatonin is something that as it gets dark at night, the body starts to produce more. And as we get older, we're going to produce less in some cases. And at the peak of the night, your melatonin, this is what gets you to sleep. And as morning comes and the light comes, the melatonin's cut back. I'm taking big steps here, but the melatonin is cut back, and then you wake. I find that you have to look at the person that's taking the melatonin. You just can't go to a health food store and grab a bottle off the shelf. How many milligrams is it? Again, I go for the lowest effective dose. I don't want to take more melatonin than I need because my body then will say, ooh, you got too much melatonin, and it will downregulate.
What would you define as low for melatonin?
A low dose. Well, what I do, start low, go slow. I'd start them at myself. I would start at 3 milligrams, and I would go up slowly, maybe 5, 6. Although, again, at the end, I want to mention some other things about it. But it would take time. It might take a couple of weeks to find your optimal dose. And do you want to take melatonin that dissolves and acts quickly? If you can't get to sleep, but you can stay asleep, I want the melatonin that dissolves quickly, gets in my system, and I get to sleep because I can stay asleep. If I don't have trouble getting asleep, I'll take extended release melatonin because it'll get me to sleep and it keeps me to sleep. So it's got to be tailored to a degree.
Got it. Okay, good. So I have another question for you, staying on this subject.
Sure.
For those that do watch television and don't have the ability to skip commercials, all right?
Right.
In all likelihood, you're going to be watching a commercial that is geared to, probably that boomer generation.
Yep.
And there's a lot of medications that are promoted that will improve memory. All right. I sometimes look at it. I'm not a doctor. I don't have the education you have, of course, but I still kind of look at it and go, really? Are people really doing this? But I want to get your take on that.
Well, first thing I would recommend is if you go in and Google today's geriatric medicine, and get the May through June 2018. Professor at the university, my wife and I wrote an article on that. And I think even today it's still a pretty good article. It teaches you how to watch for weasel words. That is to say, clinically, this is proven. Well, what does clinically mean? Did a dentist do it? Did a doctor do it? Did a pharmacist do it? And it gives you ways to evaluate this. A lot of it, I think, is just pure money making, and actually, some of it may interact with other medication that you're taking. That concerns me. My doctor, we don't always see eye to eye, but he knows everything I take, and we discuss everything, and we come to an agreement. So I'm cautious when it comes to television. What does Joe Namath know about hearing aids? You know.
Right.
By the way, hearing aids are very important to keeping your memory.
Yeah, no, I'm glad you brought that up. So
very
true.
Important because generally, as we age, presbycusis is a loss of high frequency sound. I got my first hearing aids because I couldn't understand the girls in class; their voices were too high. But if you're not picking up those frequencies, that part of the brain is not being stimulated, and when you don't use something for a long period of time, it'll atrophy. It'll waste away. So
I use that same excuse, by the way, with my wife and why I can't hear her.
Yeah, I did it with my wife, but she caught on.
All right, good. So we're going to take a quick break, I promise.
Okay.
Just about 30 seconds just to recognize our sponsor, and we'll come back and learn so much more from you. So,
okay.
Do you know anyone who may be concerned about an older driver? Well, Senior Care Authority's Beyond Driving with Dignity program is a facilitated self-assessment program for older drivers. This program has been designed to serve as a vital tool to facilitate older drivers and their families as they make the appropriate decisions regarding the future of one's safe driving career. If the individual is a safe driver, an advisor will provide him or her with strategies on how to remain a safe driver as they progress through the aging process. If driving retirement is the appropriate decision, then the individual and their family are offered possible alternatives, resources, and a specific plan to ensure a smooth and successful transition from the driver's seat to the passenger seat. So to learn more, you could go to www.beyonddrivingwithdignity.com or call 877-907-8841 to connect with a Senior Care Authority advisor in your area. So we are back with James Seversky, who's a retired assistant professor and just a specialist in memory care and geriatric care, and we're learning a lot. So first, Jim, maybe you could share with our listeners, websites, any information on the great work that you've been doing and continue to do. So I'll let you go ahead and let them know.
There are some good websites out there, but we have to be careful. Some websites are not accurate. I use Medscape is one of them that I use. It's on the technical side. No charge for that. You just need to register. So I will use that. I also use the Alzheimer's Association. Although they're the Alzheimer's Association, they do deal with other neurocognitive disorders. So I will go to them. The big teaching hospitals in Philadelphia and Maryland, I will get into their websites. They have a lot of good information there. But I go to the websites that I recognize and that I've checked out, because for every good one, there's probably 1.5 that aren't that accurate.
Gotcha. And what about if people want to learn about, you've done some fantastic studies and
Mm.
research. Is there somewhere specific to go, or just Google your name? What do you say?
Well, you can Google my name. My wife and I and other colleagues have done a lot of writing in Aging Well and Today's Geriatric Medicine. I like that journal because it's written in plain medical terms. There's no scientific jargon that's thrown around there. I was just looking at one on over-the-counter medication a pharmacist wrote. Very good for people uh, to understand that. Even what I've said about DSM-5, there was a conference issue in Aging Well that was out in November, December of 2012. And one book I'd like to mention, I have two chapters in it. It's in its third edition. It's a comprehensive guide to geriatric rehabilitation. Churchill and Livingstone is the publishers. Uh, Most of what I've said today is in that chapter plus more. It's chapter 47, I believe.
Great.
And you might be able to go in and Google that chapter, just that chapter, but it's a very good book. There's 70 some chapters in it. It's all written by professionals who are working in the field, and I just recently learned that it's been translated into Chinese. So if
Wow.
we have any Chinese listeners, uh, never fear. Uh,
That's great. Hey, listen, these challenges are happening around the world,
you
not
know,
just here. So, yeah,
without a doubt.
yeah,
Uh,
yeah. Well,
so,
good, good. Well, thank you for that. So, just a couple more questions before we have to finish up. I mean, uh, what about brain exercise? Any suggestions as far as
oh sure.
just good brain exercise?
Well, my wife, a PhD from Israel, we did a study with intellectually disabled individuals, and we used a computer program, and the results were positive. But the thing I want to bring out is when we were tearing the study down and putting computers away, a young lady walked in and said to one of my students, the students actually did the therapy, "Who is he?" And she said, "He's the professor that made this possible." And she was about 47, and she looked at me. She looked mean too, but she looked at me and said, "I like this. It makes me think."
Mhm.
So anything
That's
that
great.
will make you think.
Gotcha.
Scrabble's a great game because there's spelling, strategy, and math.
Hmm.
So
Yeah.
those are good exercises that you can utilize. Um, Crossword puzzles we mentioned, as long as they challenge your memory. I did 4.5 years in prison working with psychiatric inmates, and I used a lot of hidden pictures. Can you find 10 of these? And after about 6 months, the social worker told me families and the guards were asking what we were doing because the inmates we had were acting different, were more social. So even children's games, especially if you have somebody who's in the advanced stages, I will use color, I will use music, um, uh, anything. What's your favorite color? I will go into a group and ask Alzheimer patients that. When I ask them that, they see me, stimulates one part of the brain. They hear me, stimulates another part of the brain. They think about what I said, yet another part, and then they respond. And if they can, I'll give them a choice. But that's 4 areas of the brain from one simple question. So
Right.
something new. Travel's great, by the way. Um,
Hmm.
um, Learning about different cultures, rebooking your flight and stuff like that. So anything that's challenging, anything
Right.
that's novel, and you'll see actually your speed will get better at these exercises.
Yeah.
And there's a lot of computers. Cognifit is one, and there's another one I'm blocking. Maybe I'll get it before the end.
Okay.
That you can also use.
So Alzheimer's Association, AARP, they come out with all these studies. It's the same study. Kind of drives me crazy a little bit,
Yeah.
but it's, the question is, where do you want to live the rest of your life? And, over 90% of the people want to live the rest of their life at home. I can't believe it's not 100%. And I wonder why they spend so much money on those studies, because everybody does. They all want to live at home, but maybe it's not going to be safe for them to be at home. Maybe it's not the best for them to be at home, because they could be at home and just sit in front of the TV all day long. All right.
This is true.
So tell me your thoughts about that, because that's things that we do, I deal with, and my organization deals with all the time. And having more social interaction, I just know is so important.
It's also preventative too.
Right.
If they're at home, I will never do something for a person with a neurocognitive disorder that they can do themselves. A lot of times family come in and take over. If they can make coffee, they're going to make coffee. If they dress themselves, they're going to continue to dress themselves. I don't want to take skills away. I want to maintain those skills. And when they lose them, if they can't make coffee anymore, I'll put the water, the craft, the coffee. I'll put it in a line for them so they can make coffee. And when it gets to the point where they can't do that, I'll have them turn it on. Individuals need to have a sense of control. And I say give them controlled control. I'll say, what do you want, a yellow sweater or a blue sweater? It's their choice. They're in control. That's my point when I work with my clients, is that they should have as much control and autonomy that they can manage safely. When they can't manage it safely, and when they're placed in a facility, I had an individual once. He wanted to go to Las Vegas, so he was in a personal care home. He stored away in a mail truck so he could get off the ground. So they put him on the secure treatment unit. Well, it had a 6-foot fence. He was over that like a deer. In no time, finally, they moved him to a personal care that had more men and had activities for men. Never tried to leave after that.
Great. So that time, just for one more, question,
Sure.
and you maybe touched on sleep disorder and all that, but talk to us about REM behavior disorder, and what is that exactly, and let's talk about that. Yeah.
This is a bit personal for me, because about 6 months ago I developed it. And how did I know I developed it? When I was sleeping and dreaming, I punched my wife in the head. Okay? And that was part of my dream. When you dream, you're paralyzed. You're tonic. So you don't hurt yourself. There's times now when I'm dreaming, I act out my dreams. Some people have hurt themselves and have hurt their bed partners. So I think, and again, my wife knows what REM behavior disorder is. It's predominantly in men. Women tend to get it 40, 50, and 60, men a little later. The thing that's a bit, I don't know, perplexing about it is that in about, on average, 8 years from when you start having REM behavior disorder, the individual will develop Parkinson's disease or Lewy bodies disease or multiple system atrophy. And it'll appear in about 8 years. So I hope I'm on the average. I hope I'm on the 12. But nevertheless, 70 to 90% of the male patients go on to develop one of them. So if people are yelling in their sleep, if people are falling out of bed, if people are air kicking, is what I call it. I've done that twice. If they're doing that, they have REM behavior disorder. Now, you can see probably a neurologist. Sometimes doctors aren't necessarily aware of it because they don't ask about it. It also has an advantage if you want to get it in a study, for Parkinson's or Lewy bodies. This is a good prodome
for those that are listening and are experiencing this. Is it maybe put their nerves at ease? It's not an automatic that.
No, it's not. It does take time.
Yeah.
I'm treating my own with melatonin.
Mm-hmm.
2 drugs, clozapine, which is a benzodiazepine, anti-anxiety. I don't like to get. I wouldn't get involved with it unless I positively, absolutely had to. But melatonin, I'm still toying with the dosage, but I have very few episodes now. But if I were to tell you how I was taking it, it might not work for you, and it might not work for the next person. You kind of got to feel your way through it. It's embarrassing, and I would tell people that it's a disease and not deviant behavior. That's what people have to understand. And you can't control it. Sometimes people end up sleeping in different rooms. I holler at night. I have a 9-pound poodle. It becomes Casper the Friendly Ghost. It disappears. It knows what's coming. So you've got time. There's other things I do, but they're pretty much off-label. I continue to exercise. I do take one supplement, but that hasn't been proven. It's just that I think it's safe. So REM behavior disorder, for those individuals who might be experiencing that, there are things you can do, and you can prepare for the future very readily.
Is it something that happens frequently, or is it just a once in a while thing?
Well, in males, it's more frequent than females. It's not uncommon. I guess I will put it that way. I don't know what the frequency is because a lot of people don't report it.
Right.
When you go to a doctor's office, you fill that form, breathing disorders, blah, blah, blah. They don't have. Do you yell in bed? Do you fall out of bed? So a lot of people, when I lectured on this, and if I did it again, it would be more nuanced. But when I lectured on this, I'd have people come up to me and tell me these stories that, in some cases, were frightening, if not frustrating and embarrassing for their loved one. And I had patients as young as 35 have this.
Jim, thank you so much for joining us on Boomers Today. It's just a delight to have you, and thank you for sharing all your knowledge. Really appreciate it.
No problem. Thank you, Frank.
And thank you, everybody. Please be safe out there. Talk to everybody next week.
You've been listening to Boomers Today with Frank Sampson. To learn more about today's show, visit boomerstodayradio.com and join us next time for another edition of Boomers Today.